All right, guys, welcome back. My name is Dr. Lukin. I'm here with Timothy Meyer. And again, today we're going to continue our conversation about EMDR. But today, instead of talking about trauma or doing a demo, we're going to shift a little bit and talk about anxiety, specifically about different types of phobias. That's maybe not something that comes to mind when you think of EMDR, as typically as if you watched any of our other videos, really focused on trauma. But interestingly, there's also applications for anxiety and phobia. So today we're going to expand a little bit more about that. So what are your thoughts? How would you apply traditional EMDR for trauma, and now we're kind of shifting set, if you will, and talking about anxieties and phobias?
Yeah, so typically when, I don't know, if you watch our YouTube videos or if you look into EMDR, a lot of it is you're looking into the past,
right?
Of things that have happened in the past and doing that work back there to process some painful life events that happened in the past. Mm-hmm. However, we can also be using EMDR on current issues and future issues as well. Mm-hmm. And we can be using the same techniques, the bilateral stimulation, to address the difficulties and discomfort that come with current and future problems. And so when we're focusing on some like anxieties or phobias, we're using EMDR techniques for current and future issues. So for example, let's say if someone is coming in with a phobia of, I don't know, maybe going on airplanes. Right? A lot of what we talk about in EMDR is movies. So if we're talking about painful life events from the past, we're talking about that movie. Now, in this case, we'd be talking about a future movie of the person going to the airport to go onto the plane to go to fly to Hawaii, right? So to put it in a very, very simple nutshell, what I would do is I would have that person play the movie and start at the very beginning. And the very beginning might be, I don't know, a week before the trip leading up to it.
Right.
And so they play that movie, and then they sort of verbalize it out loud to me, and we're kind of chatting. And as soon as their discomfort rises at any point in the movie, we sort of pause right there. It's almost like I imagine we pause the movie and we keep the image up on the screen. And then we use that image for EMDR processing. And we work to process that piece of the movie until the disturbance is all the way down to a 0. And then we say, okay, great. And then we start at the beginning of the movie, and then we play it. And then we get to the next spot where the disturbance rises. And then we pause the movie right there, and then we process that piece of the movie until it goes down to a 0. And then we say, great. And then so on and so forth. So the idea is to be able to kind of process through all of the difficult and challenging parts of the movie, so that way we can play the entire thing over and over and over again, and feel safe and grounded and secure and comfortable. And the idea of the homework and the practice would be to have the client play that movie numerous times leading up to their flight, for example, and then they go on the flight, and then they're having a good time in Hawaii.
Exactly. One thing, I would imagine this scenario really applies to basically any concern, anxiety, phobia. It's just one thing that comes to mind. Often when I work with some individuals with anxiety, public speaking or presentations really come up as a big concern. And I notice that it's not necessarily like a week or 2 weeks in advance. It could be when the boss says like, hey, you have a presentation in 3 months, in 6 months, right? And even that 6 months is, I don't know if some of the viewers can relate to this, is anxiety provoking, because in a way you can't really do much about it because it's 6 months in advance. So preparing doesn't really work because you need to be closer, you don't even have the right information. But that trigger, that anxiety, that low level anxiety kind of still exists, could be for 6 months, and that's, if you could think about that, pretty torturous.
Yeah,
so I'm wondering the same technique could be applied for something like that and really save people an enormous amount of distress.
Absolutely, yeah. So having that person play out that future feared event, and going through it, and let's say their disturbances, really rise as soon as, I don't know, in their movie they show up to the lecture hall.
Right.
And then we say, okay, so you just walked into the lecture hall, let's take that image right there, and then we work to process that. And then so we get to the part of the movie where you're able to enter the lecture hall and we feel calm and comfortable in the movie.
Right.
And we say, okay, great. And then we get to the spot where you're actually up on the podium. and then the disturbance rises up to level 6. Okay, then we pause it there and then we work on that, right? So to be able to work on all those parts of the movie where the disturbances rise and to get them all to a spot where they're low or non-existent, I think it would lead to a much more enjoyable 3 to 6 months.
I just think of a couple of clients that come to mind that it's always there. It impacts their sleep, impacts their eating, and you can't really say that it's there. You know, it's incredibly debilitating, but it's kind of, as I said, kind of this low-level anxiety that's ever present, which is it's very difficult, I would imagine, you know, to handle.
Sure, you know, having nightmares about it, difficulty sleeping, overall stress levels, absolutely.
Have you ever had this opportunity? So let's say somebody has a presentation 6 to 12 months from today, right? They come in, they do this work, right? They reduce it. Do you ever hear back, like from the individual, that you know, through this process has decreased the let's say the movie anxiety or the stress, but then when they do it, like the experience is different, maybe not as high of anxiety as they thought, but not as low as during treatment? Do you ever find that? Like, how do you deal with that? Does that mean person comes back for more treatment? Because I would imagine that's a, you know, that's something that some of the viewers might want to know, because it sounds, you know, in a way, it sounds too good to be true, right? You come in for a couple of sessions, you reduce, and all of a sudden, you're not worried about presentations anymore. So I guess I want to make sure that maybe you could talk a little bit about how that would look like.
Yeah, that's a really good point. So of course, the movie that's created for the future event is not going to be picture perfect. You know what I mean? Because it's really our best guess. Most of the time, because of the movie that we create is sort of what we imagine it will be, and there's a lot of similar aspects to what it ends up actually being. Typically, you know, through the processing, people are able to get access to resources that they really need in those high stress moments. And the idea is they play that movie out almost like practice over and over and over again. So I like to use this analogy a lot. Sports players, right? They practice physically all the time, but they also practice mentally. If a wide receiver on a football field knows that on one play they need to run 5 yards and then plant this way and turn this way and catch the ball this way, they play that movie out over and over and over in their mind. And that practice is almost just as important as the physical practice on the field. So by having someone practice and play out this movie with this desired scenario where they're feeling okay, it won't be exactly the same as what it's going to be, but it will probably be close enough, right? And oftentimes it does work really, really well. Now, of course, something terrible might happen, and it could be, you know, the most anxiety-provoking day of their life. But one thing that we know about anxiety is oftentimes we completely blow it out of proportion, and then we go through it and we realize it was super small. So kind of like what you said before, the 3 to 6 months leading up to the presentation or what have you, it's really getting folks comfortable there, and comfortable the day of, so they can kind of go through it and then come to that realization that we almost always get after having done something difficult. We say, oh, that wasn't as bad as I thought it was going to be.
Right. Okay, well, that's really good to know that there's opportunities to kind of almost like pre-work it, if you will, that help process some of the anxiety, so that the individual is, you know, potentially, even with time, could begin to, you know, to be effective during that presentation style. As always, thanks so much, Tim, for talking about EMDR and how now, you know, they could be really applicable to a variety of different concerns, right? As I said, we've spoken about PTSD today. We talk about anxiety, and you know, we'll see what other presentations and what other conversations about EMDR we'll have in the future. As always, thanks so much for tuning in. Take care. Bye-bye.